but now I got the keys. I feel so pleased. All types of cars, Fiats, Minis, Renaults, you know, boom, boom, let's go. Wheels for sure. Car leasing for every credit score. If you having credit problems, I feel bad for you, son. 1,000 problems, but a car rank 1. Wheels for sure, got me back in the car. Leasing with my credit, I was like, man, forget it. Who would've thought I'd be accepted and more? But now I got the keys, I feel so pleased. All types of cars, Fiats, Minis, Renaults, you know, boom, boom, let's go. Wheels for sure, car leasing for every credit score. If you having credit problems, I feel bad for you, son. 1,000 problems, but a car rank 1. Wheels for sure, got me back in the car. Leasing with my credit, I was like, man, forget it. Who would've thought I'd be accepted and more? But now I got the keys, I feel so pleased. All types of cars, Fiats, Minis, Renaults, you know, boom, boom, let's go. Wheels for sure, car leasing for every credit score.
So Nikki, you're a winner.
Yeah, I've won 3 times now.
Wow, is that all through Lifestyle Bids, right?
That's right. So first I won the Music Awards, which was in London. Then I won the boxing match, which was in Cardiff. All I had to do was bid 83 pence for that. And then the music festival, which was in California.
And the private jet?
Yeah, made me 3 mates on that too.
So I think it's definitely safe to say that Lifestyle Bids works for you.
Oh yeah, Lifestyle Bids definitely works for me.
So don't just dream it, bid it. Go to lifestylebids.com and let the adventure begin.
Majesty, yeah, I try to be so. I be fi say me heart no dey work again. I be fi say me heart no dey love again. Now there you come, you give me the ginger loving. Say you got me, give me the sugar loving. Now they say they love me. Let me say, now they say they want me. Waiting and giving us so chest pain. But where you come, you give me the sugar loving. This kind of love. Now you just scatter me body, oh, this kind of love. You didn't enter me body, oh, this kind of love. I want for me body, oh, this kind of love, this kind of love, this kind of love. Baby, they regulate me body like a stabilizer. You they give me the love and they clean me life like a sanitizer. Baby, fine, never play me corny. Fresh like a fish and a Brooklyn Jimmy. Now they say they love me. Let me say, now they say they want me. Waiting and giving us so chest pain. But where you come, you give me the sugar loving. This kind of love. Now you just scatter me body, oh, this kind of love. You didn't enter me body, oh, this kind of love. Now I want for me body, oh, this kind of love, this kind of love, this kind of love. I be fi say me heart no dey work again. I be fi say me heart no dey love again. Now there you come, you give me the ginger loving. Say you got me, give me the sugar loving. Now they say they love me. Let me say, now they say they want me. Waiting and giving us so chest pain. But where you come, you give me the sugar loving. This kind of love. Now you just scatter me body, oh, this kind of love. You didn't enter me body, oh, this kind of love. I want for me body, oh, this kind of love, this kind of love.
Momix.
A true story from me mama. Back in the 60s, can down to the 80s. Hey, yeah. Can look where we did to line like King Jimmy. Say I get me young God give. Fitting bets with no regrets. With me to the on-solid join a net. And me picking every money. See, mommy mo do with in front, papa holu with in chest, Sisi Ebu with in Lady Diana. And look where, but just see they dancing rumba, mommy banks they dancing sukus. Hey, yeah, papa they dancing culture, so traditional. Today this time, be they take with them for bogey. See, on my witty yon, spend the gala. On my witty yon, witty yon wahala. Drink and food now be next to nothing. Damn, aye Joe, on my guy yon. Voila, aye Joe, on my guy yon. Mommy mo do witty frock, papa holo witty chest, Sisi Ebo witty Lady Diana. Can look where, pa Johnson they dancing rumba, mommy banks they dancing sukus. Hey, yeah, papa they dancing culture, so traditional. We party in a Freetown, we party in a Motown, we party in a Kenema, till the sun go down. Kenema na disco parties, Motown na uptown, Freetown na attitude, till the sun go down. Kenema na disco parties, Motown na uptown, Freetown na attitude, till the sun go down. Holy on, eh, holy on, eh, holy on, hold on down. Holy on, eh, holy on, eh, holy on, hold on down. Pa Johnson they dancing rumba, mommy banks they dancing sukus. Hey, yeah, papa they dancing culture, so traditional. Today this time, tell them, be they take with them for buggy. See, on my witty yon, spend the gala. On my witty yon, witty yon wahala. Drink and food now be next to nothing. Aye Joe, on my guy yon. Aye Joe, on my guy yon. Voila.
Lamzo J on the mix. I know like man where they give me bonnet. I know they do man where they do me feke. You for they call me out like a cold water. Who that day when I let it go lights. I'm not for the cry, you're not for the lie. You for the love me so tight, my heart desire. I'm not for the cry, you're not for the lie. You gotta love me so take go, my heart desire. Not only me, you gotta love me go, baby. Only me, not only me, now your heart desire. Oh, not only me, you not for look other woman, not only
say, do you know my life is here for you? I give you anything where you want, baby. I say I give you everything where you need. I not gonna lie, you not gonna cry. I gonna love you so there, me I desire. I not gonna lie, you not gonna cry. I gonna love you so there, go, my heart desire.
Now only me,
I gonna love you, go, baby.
only me,
Now only you, my heart desire.
now only me,
Oh, I'm not gonna look at that woman. Now only you, baby.
now only me, now only me. Do, oh baby, do. My baby, do. Oh baby, my baby, I'm not for the cry, you're not for the lie, you for the love is so dead, my heart desire. I'm not for the cry, you're not for the lie, you got the love is so dead, my heart desire.
Gen X music.
For fun. Oulele. Oh, yeah. It don't tell we man they wait. Sweet music we don't create. Some man them no appreciate too. Mama tell me not for it. She over must up in the gate. Now they see we then they hate too. Oh, it don't tell the way too. Papa got the open gate too. Plenty money man they make too. My girlfriends are they calculate too. Now wait too. But when I give me the chance make we rock this party. Now wait too. When I give me some space make we make this money. Now wait too. We want give people good music for shake them body. Now wait too. This table on turn. Now wait too. Yeah. Back in the days them me sign way. Later man them begin criticize we. They no be no say God get him plan me, God get him plan me. Say much a man not to God where some of you want to we suffer and die and shame. And once that God now we make her. Once we trust him we no go ever end pain. And I believe in his words, yeah, yeah. And I love don't keep it stronger every day. Oh, he don't tell the way to. Papa God open gate too. Plenty money man they make oh. My girlfriends are the calculator. Now wait too. But when I give me the chance make we rock this party. Now wait too. When I give me some space make we make this money. Now wait too. We want give people good music for shake them body. Now wait too. Table on turn. Now wait too.
Yeah, so far yeah, not be Lily. Not only Papa God know the reason. Are you the drum, the trouble, they love you. And you get used to the meaning. And the batter the clock still like a Dr. Law.
Okay.
If you see the music sweet, now the way they for down, the way they sit down, the way they look down, boy. For this is all about reality. My dad they do them best till they know they see them. The one the way they got Bakuna Sina, then they get it top label, then at the country they know they see. Yeah, we don't need patience and they watch. Now the 10, we go give it 10 man and starch. We go big in 10 man and the 2 then them stocks. If you ask the only bars, you get flow, go meet bash. Yeah, we just the in for the big cake. All that bubble man and go to twist face. Baby, she not heat, this not big case. Cause now we get the lottery for Medi, baby, bro quiz. So test, whoa.
Now wait too. But when I give me the chance, make we rock this party. Una wait up, una give me some space, make we make this money. Una wait up, we want keep people good music for shake them body. Una wait up, it's table on turn, una wait up.
It don't tell man than they wait up. Papa got the open ghetto. Plenty money we dey make up. A conference we dey calculator.
Una wait up, but una give me the chance, make we rock this party. Una wait up, una give me some space, make we make this money. Una wait up, we want give people good music for shake them body. Una wait up, it's table on turn, una wait up. Hydro mix.
Yeah, fall for one again.
Splendid, the magic finger.
Fall for one again.
Life, yeah. Life, I shall say, life, yeah. If you want success, you know easy, yeah. You get for work from 7 to 5, just forget your daily bread, just for make you survive. Life, yeah. If you want success, you know easy, yeah. You get for work from 7 to 5, just forget your daily bread, just for make you survive. I open it, 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 I open it. There are funny things about life. Your hug should be sharper than knife. Believe in yourself and nature will provide. Cause once I go this stuff I must survive. There are funny things about life. Your hug should be sharper than knife. Believe in yourself and nature will provide. Cause once I go this stuff I must survive. Respect my hustle. Hey, my hustle. I go respect your hustle. My hustle. Life, yeah. If you want success, you know easy, yeah. You get for work from 7 to 5, just forget your daily bread, just to make you survive. Life, yeah. If you want success, you know easy, yeah. You get for work from 7 to 5, just forget your daily bread, just to make you survive. I open it, 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 I open it. Life, yeah. Life not easy at all, oh, yeah. Mama dey vex, Papa no dey put up money. Life, yeah. Life not easy at all, oh, yeah. Mama dey vex, Papa no dey put up money. Respect my hustle. Hey, my hustle. I go respect your hustle. My hustle. Life, yeah. If you want success, you know easy, yeah. You get for work from 7 to 5, just forget your daily bread, just to make you survive. Life, yeah. If you want success, you know easy, yeah. You get for work from 7 to 5, just forget your daily bread, just to make you survive. I open it, 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 I open it.
Oh na 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 na. Mahmoud, Slim, yeah. You know go help me for eyes and go and see you fall. You know go lift you up and go wave make you fall. Everything I have today, now by you. You can see where I be today, now by you. All praise to Baba, Baba. All praise to Baba, Baba. Yeah. All praise to Baba. only you don't take me this fire. Now it make I no go ever miss fire. With your love I no go ever retire. God, only you don't take me this fire. With your love I no go ever miss fire. I no go ever miss fire. Hey, Papa. You show me but cool up, then don't take me joy away. Lord, I put them for wonder, I put them for trauma. Let them come out that you to your brother. Papa, now you the bless me. But cool up, you know that's me. Oh, yeah. Wake up every weekend at Dubai. Papa, now you my master planner. Giovanni's, you my provider. Yeah. Hey. Papa, now you the bless me. Even people who call me family turn around and be me enemy, yeah. You don't love me, Papa, yeah. Shout out to all them fake friends, eh. You are the past and take what and forget I me. You think you do me, hola. You think you killing me, la la. And go there look for way for put you down, yeah. You go there wonder. You do bad. Now the same people who will say crucify. One of the words first. God bless you, my brother. Bless you. God know they look first. God bless you, my sister. Whether you be carpenter, messina, whether you be fitter, brother, whether you be marquee too man.
If you having credit problems, I feel bad for you, son. 1,000 problems, but a car ain't one. Wills for sure got me back in the car. Leasing with my credit, I was like, man, forget it. Who would've thought I'd be accepted and more? But now I got the keys, I feel so pleased. All types of cars, Fiats, Minis, Renaults, you know, boom, boom, let's go. Wills for sure, car leasing for every credit score.
So Nikki, you're a winner.
Yeah, I've won 3 times now.
Wow, is that all through Lifestyle Bids, right?
That's right. So first I won the Music Awards, which was in London. Then I won the boxing match, which was in Cardiff. All you had to do was bid 83 pence for that. And then the music festival, which was in California.
And the private jet?
Yeah, made me 3 mates won that too.
So I think it's definitely safe to say that Lifestyle Bids works for you.
Oh yeah, Lifestyle Bids definitely works for me.
So don't just dream it, bid it. Go to lifestylebids.com and let the adventure begin.
So Nikki, you're a winner.
Yeah, I've won 3 times now.
Wow, is that all through Lifestyle Bids, right?
That's right. So first I won the Music Awards, which was in London. Then I won the boxing match, which was in Cardiff. All you had to do was bid 83 pence for that. And then the music festival, which was in California.
And the private jet?
Yeah, made me 3 mates won that too.
So I think it's definitely safe to say that Lifestyle Bids works for you.
Oh yeah, Lifestyle Bids definitely works for me.
So don't just dream it, bid it. Go to lifestylebids.com and let the adventure begin.
Salon man, if we want make salon, we for change we attitude. Salon man, if we want make salon, we for change we attitude.
Na for nothing, we all na mortal man and we get for life. So let we left Congo Sahel and for bad that we come. So if we sabi wasan, we go eat na big man the hand. For catch big man and I can't down. No today. You go get after, now where you big man and you get. So let we left Congo Sahel and for bad that we come in them.
Salomon, if we want make Salon, we for change we attitude. Salomon, if we want make Salon, we for change we attitude.
Na for nothing, we all na mortal man and we get for life. So let we left Congo Sahel and for bad that we come. It's holiday, so if we sabi wasan, we go eat na big man den man. For catch big man and I can down. No today, all thing done. You go get after, now where you big man and you get. So let we left Congo Sahel and for bad that we come in them.
Yeah. Ah, yeah. Yeah, follow me, they go, make you they see something. It's not that I'm tipsy or it's in my gin. Before you they go, I tell you one last thing. I'll make you a queen if I can be your king.
I thought I would never love again. I thought I was done with men, but when I'm with you, I don't want this to end. This to end, this to end. We are two of a kind. Never let me go. And when I wake, it must be you. I see, I see.
I want you to know that I don't want you to go. I want you to know that I don't want you to go. I know to pretend, girl, you already know. You already know, you already know. I want you to know that I don't want you to go. So don't you pretend, girl, you already know. You are the reason for each and every love song. Aye, listen. This na me act, na you young for tick. Waiting on you relax, na me young go shake. Though I walk through the valley and shadow of chicks, this na the girl that I can't forsake. Cause back then when I know one go, I know one got it well, one green fine close, na me kanda. Any side way I turn for help, now you want, you deserve all things. So we go, so we can, but
we are two of a kind. Never let me go. And when I wake, it must be you. I see, I see.
I want you to know that I don't want you to go. I want you to know that I don't want you to go. I know to pretend, girl, you already know. You already know, you already know. I want you to know that I don't want you to go. So don't you pretend, girl, you already know. You are the reason for each and every love song. I want you to know that I don't want you to go. I want you to know that I don't want you to go. I know to pretend, girl, you already know. You already know, you already know. I want you to know that I don't want you to go. So don't you pretend, girl, you already know. You are the reason for each and every love song.
So Nikki, you're a winner.
Yeah, I've won 3 times now.
Wow, is that all through Lifestyle Bids, right?
That's right. So first I won the Music Awards, which was in London. Then I won the boxing match, which was in Cardiff. All I had to do was bid 83 pence for that. And then the music festival, which was in California.
And the private jet?
Yeah, made me 3 mates on that too.
So I think it's definitely safe to say that Lifestyle Bids works for you.
Oh yeah, Lifestyle Bids definitely works for me.
So don't just dream it, bid it. Go to lifestylebids.com and let the adventure begin.
If you're having credit problems, I feel bad for you, son. 1,000 problems, but a car rank 1. Wills for sure got me back in the car. Leasing with my credit, I was like, man, forget it. Who would have thought I'd be accepted and more? But now I got the keys, I feel so pleased. All types of cars, Fiats, Minis, Renaults, you know, boom, boom, let's go. Wills for sure, car leasing for every credit score.
Hello, good evening, ladies and gentlemen. Una hello, mama, papa, them. Una good evening, everybody. On this amazing, wet and a bit cold Thursday evening, the 19th of March. This is Isatta Sisay-Jalloh on the Health Show, live on Diaspora Voices. And today we're going to talk in general about our dear friend and enemy, coronavirus, the novel coronavirus COVID-19. We're going to have a casual, should I say, we want to make it as casual and informal as possible so that we can get the message across. We want it to be an interactive session wherein I'm not going to just come and talk at you, but I want you to be able to contribute as well as ask questions and so on and so forth. And with me today, I have got two very important people. I have got on, they said ladies first, sorry, Wahab. I have got on my right, Hannah.
Good evening.
Hannah is an educational specialist. And I know, you know, with the coronavirus, we've had some really alarming news yesterday about the schools, the closures, the GCSE and AS level exams. So she's going to come and shed some light on this issue for us. And then, of course, we've got Abdul Wahab Sisay on my left, aka DJ Little, CEO of Diaspora Voices. He's not wearing any of those hats today. Today he's wearing an infection control hat. So we're looking at how we manage this infectious disease and how we adapt to some of the rude awakenings we're facing literally by hour, and how we manage them and how we cope and so on and so forth. I'll be quite the generalist today, just to kind of feed in here and there where I can. But it's going to be really an open program today for us all to talk and share and learn, as I always say. So this coronavirus, we know it's transferred via respiratory droplets. It's a virus, and at the moment, there's still no cure for it. There's still no vaccine for it. So that's why it's become such an issue, and it's killed thousands and thousands, I think over 200,000 people in the world so far. And it gets to a country, it starts off slowly and then it goes up to the peak and boom, it becomes quite problematic. We know it originated from a small town called Wuhan in China. They, touch wood, or hopefully they've gone through their worst. And then it trickled its way to America as well as mainland Europe. They've had to do a lot of lockdowns and shutdowns and so on and so forth. And then within Europe, of course, where we are, we've also got it and we're struggling with it. We're trying and so on and so forth. But one thing I want people to realize is keep an open mind. I think we are all quick to jump to conclusions. Well, most of us, I don't want to be to generalize. We're quick to blame. We're quick to assume, we're quick to judge. This is a virus that nobody knows. Not even the smartest scientists in the world really know what's going on. Our chief medical officer in the UK, Chris Whitty, is constantly telling us, this is what we know right now, and based on that, this is what we're doing. However, we don't know what we're going to do in the next hour or two, and so on and so forth. So they're really, it's a reactive process at the moment. As the data comes in, so they're reacting. So let's be patient, let's bear with them. And I also want to highlight something, especially for us in the UK. Let us be thankful for having a National Health Service. Let us applaud all workers within the National Health Service, and that goes from the delivery people, the cleaners, the chefs, the cooks, and so on and so forth. Not just the doctors and nurses, the administrators, every single member of the NHS, let us, or within the health and social care network, let us be thankful for them, and let us show solidarity and support them at such a difficult and challenging time, because it is frightening, it is scary. A lot of us as healthcare professionals or workers within, public schools, everywhere, every one of us that faces the majority of the public as public servants, we have not been faced with this, and it is forcing us to change a lot of things within a short space of time. It's forcing us to change our practices. It's forcing us to change our way of thinking. It's forcing us to change our culture, our tradition. A lot of us are used to hugging and shaking hands and kissing and so on and so forth. It is forcing us to do the things that we're not comfortable with or convenient with. So we have to be mindful and just think before we start judging the NHS, because I've had a lot of audios coming through my phone. People saying, "Oh, I went to the hospital. Can you believe they left me? I've got this age of child. How can they do this?" And so on and so on and so forth. You were not there. You don't know the full story. There's always a saying that there's 3 sides to a story: yours, mine, and the truth. So please be mindful. Be mindful when you press that send button. When you get these posts through your phones or social media, be mindful. Think carefully before you make a comment. Think wisely before you share. And think sensibly before you press the send button. Because there's so many fake news out there. There's so many rubbish news out there. And it's not making the situation any better. It's actually making it worse. And you also have to think of that individual that is going to be the recipient of that message you're sending. For example, there's this old video going around of the 2011 London riot. And people, for some reason, somebody has decided that from yesterday they were going to repost this and claim that they're fighting for food and so on and so forth in Peckham. And then, of course, anxiety and fear kicks in. So people didn't even look and assess the background of this video. Because if you do, and if you did, then, and if you've lived in Peckham, you would know that this is an old video, because the Peckham now is different from the Peckham then. So, because there was one particular shop in that video that no longer exists in Peckham, so people should have realized that. But what did that cause? That caused a lot of fear. I was woken up from my sleep 7 o'clock this morning by a niece of mine who was in a panic mode. Have you seen? Why? Because we know there's so many people, business people in that area. In our community as a Sierra Leonean, we have a lot of Sierra Leoneans who own businesses in there. So can you imagine being woken up, or you wake up 7, 8 in the morning, trying to get your kids ready or sort yourself out before you go and open your shop. You open a video and it's telling you there's riots and they're breaking into shops. The first thing you're going to think is they're breaking into your shop. So, and what if this person has got underlying problems? They've got heart disease and so on and so forth, high blood pressure. This is how people die carelessly, because we're not thinking sensibly and responsibly. So please, brothers and sisters, let's think how we move these things forward. Let's think what we do. Let's think about how we act and how we move forward. Because like Boris said today, we all have a responsibility. We are all accountable. So let's play our part. And if it means you don't have anything to do, fine, to contribute, fine. But don't spread fake news, because it is not helping the situation, please. And don't assume. There's a lot of good information out there, all you have to do is go on BBC News website, or you listen to the news, or you listen to the radio, you watch the news, and so on and so forth. Or if you can't afford any of that and you're out and about, the Metro newspaper is out, it's free. Some of the news on it might be exaggerated, but at least there is an element of truth. And the one thing the Prime Minister has guaranteed us, every day there's a press conference. So like today, it was just gone 5, we had an update. So today we're going to go through those updates. We're going to talk about these updates that started from Monday and up to today. And that is how we're all going to be involved in it. So please join us and please be involved in it. So over to you, Mr. Wahab.
So, good evening. I'm quite appreciating the social distancing.
Yes.
Not quite a meter.
Not quite a meter, but yes.
Yeah, I mean,
and we've got our...
Yeah, I think you've come prepared. So
you've come prepared, yeah.
Thank you for inviting me here. And I'm happy to be wearing my infection control practice facilitator hat. It's just to be clear that for those who are watching, I'm not a nurse. But I'm clinically trained to deliver the education on infection prevention and control. So that's why I'm here, and that's what I'm going to be talking about based on the education of preventing, which we're no longer preventing this virus, but we're now controlling and managing this virus outbreak so that we don't get it to escalate. So I'm happy to be here to make significant contribution, which you would want me to.
Yeah, and how about you, Hannah?
Good evening. I'm happy to be here. Thank you for having me.
Thank you for coming.
I am wearing the hat so as an educationalist. So I am the head of department for maths. So I'm a maths teacher. So I lend my hand to support any questions and things that I can say about what's going to happen in schools nowadays and what's going to happen to your kids, even as some of them we know are very anxious right now. So I'll be here to help you through
Absolutely.
those.
Thank you so much. So I mean, like we said, we're going to go through the different days of the week and the press. We're going to focus on the key factors of Boris's press release. Monday, the key message was about social distancing, right? Social distancing, being 2 meters away from each other, reducing the number of groups, thinking about social venues, and so on and so forth. What is the rationale behind there? What's the rationale?
So, the whole idea about social distancing, I think what the government is trying to promote is to try and minimize the risk of the spread of this virus, because as you mentioned earlier, it's a droplet. So if I am to be within a meter close to you and then I'm having a conversation, natural instinct to many natural conversation, people will air out 1 or 2 salivas which may come out in a conversation, not deliberately, but it's just the way the human nature's. And then that droplet, and what we want to try and prevent is contact of that saliva to be exposed to either any part of the other person whom I'm having a conversation with. Either it could be your face or any part of your body which is exposed and not covered. And once that is there, you are at risk. So if I'm already somebody who is a carrier of it, but I'm not showing any symptoms, the chances are, if I'm having that conversation and then I was to accidentally spit on you whilst I'm having a conversation with you, I've put you at risk, a great risk. Even if you were to just wipe that out of your face. Alternatively, what about we look at the closed circuit when we're traveling daily. People do the hot sneezing, coughing, and all that stuff, and then you want to be coughing out in public, or you want to be coughing out in the environment which you are. If you're in a closed environment, it makes it easier for you to spread this virus if you're already a carrier. And because we are the active community, younger people at large, and when I say the under 65, and we do a lot of commuting, and but the virus does not manifest itself out because of our strong immune system, which we may have. We are actually higher risk of spreading this virus. So one of the reasons why the government wants to introduced to social distancing is to reduce the risk of the spread,
isn't it?
Yeah.
So that it's about protecting the vulnerable cohorts, which is basically the over 65s with underlying illnesses and other people with other underlying illnesses, such as respiratory issues, such as your asthma, your COPD, which is chronic obstructive pulmonary disease, your
if anybody's got
your lung
issue,
cancer, and your autoimmune illness, which makes you immunosuppressed. Your HIV sufferer as well, survivor, you are also kind of immunosuppressed, or you might be on an immunosuppressed treatment, and so on and so forth. And of course, other illnesses such as heart failure, diabetes, and so on. So it puts you at a higher risk compared to the Joe Bloggs who is going around, in their 30s, with no underlying illness, and they're eating healthy and they're staying fit. They're able to manage this infection better. So that is why they're kind of encouraging us to be socially distant from one another to protect the higher risk population. So I think this is one thing we have to think about, because I think when it all started, like everywhere else, and I think in Italy, some of the videos people have recorded and sent out, is the fact that we should have taken this more seriously. We were quite blasé, we were careless, and for our community, our Sierra Leonean community, we have similar culture with the Italians. We like to hug, we like to kiss, we like family gatherings, and so on and so forth. So this is what we have to be very, very careful about and think about, because there's so many myths going around that it doesn't infect the black race. Who said that? It's already, a lot of black people have tested positive. But what they're not doing about this infection is telling you, the data is not saying at the moment, we've got 10 Caucasians, we've got 5 Asians, we've got 6 Africans, and so on and so forth. All they're giving us is the numbers. And by the way, the numbers since 9 o'clock this morning, it's 64,621 people have been tested. They have been tested because they have presented with some of the symptoms. Now, what are some of the symptoms? We know we've got 2 that we have to keep an eye on, first of all. Persistent coughing, a new cough that's come and it's persistent and it's dry, and plus or minus temperature. Now, the other thing I've heard a lot of people worried about, all of a sudden, there's no thermometer. People are thinking, how can I check my temperature at home? People are getting confused, especially people who are either premenopausal or menopausal, and or going through menopause. They have hot flushes. They do have times when they feel hot. So I'm getting calls, people saying to me, I feel hot. And then when I do ask them a bit more question, then they actually were, oh no, yeah, I usually feel this way because of this, because of that. So if you don't have a thermometer at home, you don't need to panic, because I think actually no pharmacy has it right now. Where the guidance is as to how you check whether you're hot is either you touch your chest or your back. If your chest or your back is hot, then that means you probably have a temperature above 37.5. So don't panic, don't worry if you don't have a thermometer. And out of that 64,621 they've tested, 61,352 have come back negative. Okay? And as of 1 p.m. this afternoon, we had 144, right? 144 patients who have died, and may all their souls rest in peace. And they still are strongly firm about the fact that at least 90% of these 144 had underlying illnesses, and they're above I think above even above 70 or so, isn't it? At least 90%. So I think that is one thing we need to focus on. But in terms of Abdulwahab, in terms of going back to the social distancing, I know there's a lot of conflicting information going on about self-isolation and so on and so forth. Can you shed some light on it?
Yeah.
I mean, I'll chip in where I can.
Yep, definitely. And it's very clear what the government is trying to advise, and then Public Health England is saying, is if you are living alone and then you're presenting some of the symptoms and you are being advised, or you feel that you will need to do some self-isolating, you will need to stay home for at least a week.
Yes,
okay?
7 days.
7 days.
Yes.
Okay. But if you are living with family and then either one person within the family is presenting the symptoms, and obviously whether you're at work or whether they are younger children who are in school, then the entire family is being advised to stay home for at least 2 weeks, which is 14 days.
Yeah.
So, and that's what needs to be done.
Yeah.
And you then have to then monitor your temperature. The government has been asked that everybody can just record the family temperature, where you can use that information to see if there is any spike or any the temperature level within all family members are dropping down. And then if you feel there is any necessity to go, nobody's been asked to call 111, so nobody should be calling 111. But what you need to be doing, the other thing I need to mention as well, if you're at home, there is you don't need to test. Because there's
they won't test you.
I need to be tested. So if you're at home, there's no need for you to be tested.
Yeah, and there's a possibility that the persistent cough you have might not be COVID-19 positive. However, this is all about being precautious, and it's about being cautious about what's going on and how to contain this infection. Now, one of the questions that have been coming up a lot, okay, you have a family of 4 or you have 4 people living in the house, and then one starts presenting with a symptom, and then you have the guidance is all of you should stay in for at least 14 days. Now, what happens so the person, let's say, let me give us here as example.
Yeah.
You come to us today and said, oh, I've been feeling quite hot and I'm coughing. I think I need to self-isolate. Automatically it means myself and Hannah need to join you.
That's correct.
In that isolation.
That's correct.
And for 14 days.
Yeah.
Now you're meant to self-isolate for 7 days. Now, from the day you start presenting with the symptom, which is today, you start counting, and after 7 days, if you are okay, symptom free, then you can go out. Okay? So that is the guidance. Yeah. Then myself and Hannah has to stay for that 14 days.
True.
So if on day 4 of your 7 days of presenting symptom, I start feeling and so on and so forth, I also then have to stay and start counting for 7 days.
That's correct.
And if I'm symptom free, I don't have to wait for that complete 14 days. I can go out. So basically, the person who does not present with any symptoms, as long as they've come in contact with someone who's presented, they have to self-isolate for 14 days. And I think this is very, very important, because we also had to ask for clarification of this, because the people are panicking. Oh, then 4 of us are all going to be in this house, and so on and so forth. So it's really being careful. And if you're not sure, just call 111. They'll give you advice, but just be warned. People are saying, oh, I called 111. It took 4 hours. Of course. It will take longer. They're inundated with calls. And also, we don't know how many of the call handlers themselves have actually tested positive. They might also be at home self-isolating. So we have to be conscientious when we're thinking about these things. And I know when you're unwell and you're scared, you're frightened, you just want answers now. But let's be a bit level-headed, isn't it? What do you think, Amana?
I think that's absolutely right. My question I want to ask you is about those of us that have elder relatives, so your grandma, your grandparents, and they live alone, and obviously they can't go out, and I know we have to go and help them, but but what advice would you give to those people? And I know, and also I know as Sierra Leoneans, like you said, we love to party, we love to come together, and some people are saying by corona by force they'll still get together and they'll do whatever they
Yes,
want to do.
exactly.
You know,
I had that one, I have to say. By corona by force.
But it's like, so what advice? Because I think they don't realize how important it is for us to remain isolated. You know, so how can we better help them to understand that?
Well, the elderly need quite a lot of education, but most importantly, reassurance. Now, in the last week, myself, Abdul here, Sierra Gem Media's Watch Out for the Elderly, UK, and other people like Cow Footprints, Isatta Sisay-Jalloh, and other people in the community, Tala. We've all, we've started a program where we're going to get a Sierra Leonean community rapid response team. And what we're now doing, which we've kind of started raising awareness, we're actually working, Sierra Gem Media is at home working on the flyer as we speak, is to see how best we can start a database, which we've already started, of the elderly. The elderly and the vulnerable people. So the elderly living on their own or with their partner, with no relatives. The elderly who are housebound, or people who are housebound. People who have children with some form of either physical, mental, or disability, that they are the main carers. Single parents who are in isolation, and families who are also in isolation. So what we're doing is trying to see if we can create a database so that we can be calling these people and talking to them and reassuring them, checking on them. For example, we know most of the elderly might have high blood pressure issues, they might have arthritis, they might have diabetes. They usually have a nurse or a carer that come in. Now that might continue, but it might be a bit stretched out. So maybe if they were having a carer 3 times or 4 times a day, call-ins, because there's a shortage for the carers, which we saw on the news yesterday, that care agencies are also struggling. Maybe they'll cut that down to twice a day. So that also leaves them in quite a social isolation situation. So we're going to be doing telephone support calls to these people. So please, we're pleading, we're begging, we're appealing. If you know of any elderly people or any of these cohort of people in your area, please pass on their number. We'll call them, we'll introduce ourselves. If they feel offended, we'll apologize, and then we'll put the phone down. But I'm going to be, I think, 99.5% sure none of them are going to feel offended when we call them. And if they need food, we would deliver food. If they need water, we will deliver water. People have already started donating. I think I've got about £100 in the kitty already. People are donating towards fuel. People are donating towards food, and so on and so forth. I'm not going to go out and rush to buy food because I believe there's going to be food. We're not going to run out of food. So I'm not doing the stockpiling. But at least I have the money. And I've actually started, I'm already working with one vulnerable family at the moment. They're not in isolation, but there are things going on that they need support, both financially and emotionally and psychologically. So I'm already working with them. So it's already kicking off, but and it will be happening behind the scene. Tomorrow I'll be going to Peckham and hopefully East Street Market to walk around and see if I can find any of these elderly, because that's a lot of them enjoy that, isn't it? They go out, they pick up their benefits, they go and do their shopping. The same in Dalston. If you're in Dalston tomorrow or Saturday, keep an eye out for our elderly. If you see them, you know them, ask them if you can pass on their number. If you don't know them, go meet them and talk to them. That's what I did on Tuesday. So on Tuesday I went to East Street. I was in the meat shop, and I heard this lady. She obviously comes there and she's telling off the young man that sells the vegetables, telling off the man behind the meat counter, and so on and so forth. So then I approached her and spoke to her. And I said, oh, you're shopping? She said, yes, I don't know what's happening. I said, I said, do you live alone? She said, oh, yeah, I live alone. And she said, oh, that's why I'm doing my shopping. I said, okay. And I introduced myself. I said, how would you feel if I take your number just to be checking on you? And she said, oh, no, I don't mind. So she gave me her number. So now I've got 3 numbers of elderly people who will need support. And yes, it's just for probably, we've started this for COVID-19, but actually it might
something we should do.
Yeah, it might not stop, isn't it?
Yes.
It might not stop. So I don't know if that's answered your questions to some extent.
That does.
And I think we need that. We need to find different ways to interact with these elderly. Some of them will have Android, some of them will have iPhone. When you call them, ask them so you can video call them, so they can see someone's face behind the voice, and so on and so forth. Talk to them, laugh with them, and then we can
I just add something? Go
I
ahead.
think it's just a simple hello, how are you? My grandma's like, every day I call my grandma, she's like, oh, you don't normally go. It's like, every day I'm just like, how are you? She's like, what happened? I'm like, I'm just checking, are you okay? Because I know, and then she's telling me, oh, I've got an hospital appointment. I said, don't go anywhere, just stay home, and we'll come and we'll do what we can to help you. But it's just daily conversation, just to know that they're okay. And if you know some of their patterns, maybe they're early risers, so at a certain time you'll call them, or maybe it's in the afternoon because this is the time that they're resting. So it's just knowing that someone's there that they can communicate with, because isolation, as we know, can lead to mental health issues. So it's just making sure that we look after our elderly, because they've actually look after us. So if it's not just for COVID-19, but in general, we should be doing it. So it's a fantastic motion that you put forward.
I won't take all the credit. We won't take all the credit, isn't it? Because a lady called Alisa Conte Cabo, she started this in Sierra Leone as a result of her dad suffering and dying of dementia. So she started it in Sierra Leone, but last year she approached us and wanted to trickle it down here and establish it in UK. She did do her first pensioners Christmas meal pre-Christmas last year, or what? No, I think it was in June. No, it was in June. It was in June, not Christmas. She did a thing, and it was a bit. There were a few people, but it was good. So hopefully, in our community, we don't usually welcome new things. We wait and see how it's getting on, and when it's picking up, that's when everybody gets excited about it. So it's a lot. It's going to be a lot of hard work and patience. And I've told her we're willing to support her as best as possible. So that's why when we thought about this, we actually called her on board and said, come, let's do this together. And so, because like I always say, the health show, Diaspora Voices, Countdown, we're pro partnership. That's how we work. We're very collaborative. We believe in, quite a lot of hands make a heavy work, light work. So that's what we're doing. So going back to the social distancing and isolation, we're not going to touch on schools, but we're going to touch on the kids. Having kids at home, trying to tell them, oh, you can't go out, you can't do this, you can't do that. How do we keep them engaged? How do we make sure they don't get frustrated? We know some kids like to be in their room. They're locked there and they can be on the technology for God knows how long. But I've got one child like that. But then I've got another child who likes to go out. Like today, I came back to the house. I saw a couple of milk in the fridge. And I said to my husband, oh, because then I bought milk as well. I said, who bought milk? Oh, your son. He had to go out. He didn't really need to go buy milk, but he has to go out. He just has to go out. That's my son. He cannot stay in the house for more than 48 hours and not go out. So I think, how do we manage it?
Board games, yay! Get your board games out to play with them. I know we're going to talk about schools later, so I'll talk more about it. But I have said to the school kids, I said, you guys are thinking this is actually fun, like school's finishing early. I said, you're truly going to get bored. Because after you finish watching all those Netflix, those box sets, and you finish playing all your games,
they'll
and all
finish
those
that in
levels.
2 weeks.
Exactly. So you're going to be there, and you're going to be wishing that you were back in school, the school that you don't want to be in. But as parents, I think it's just about, I think it's time to talk.
Yes.
You know, we can start talking. We can start talking to them, getting to know their likes and dislikes. Because so many of us, how many of us can actually say we know all our kids' friends and who they engage with in school? So we can use this opportunity to get to know our kids again and spend those quality time that we don't necessarily have. Because I know for me, it's always rushing in the morning.
Oh yes, all of us,
come home.
as long as you're working parent, isn't it?
You just come home, you make food. If you've done your homework, okay, let's go to bed. So you don't actually have that time to interact with our kids. So it's a perfect time, you know. And at first, probably our kids, oh, mum or oh, dad, you talk too much. Why do you want to talk? But eventually, they'll recognize that, you know. Let's make a go of this. It's good for us to get to know each other. So that's what I will be doing, and my kids are going to tell me that, Mum, you talk too much. But I know, like I said, I've got board games, Scrabble, the games that they don't like, because obviously they want to be on their games.
I think Hannah's made some good points, and for me, myself, as you all know, everybody knows I'm out there, and because of the time factor, there is always a crisscross where I don't get to see the kids apart from the morning, and then there is probably a transition of 45 minutes in the evening, and then I'm out, and you'll be leaving home at 7:30, and then your daughters are saying good night at 7:30, because by the time you return, here is the perfect opportunity for me to actually now get engaged, because it's not only that they're not going to be there, there's also possibly the opportunity where I'm also now going to be grounded as well at home. So it's a learning as well for me as well. So this is not just going to be about just the kids. It's also going to be about me,
the adults.
And one of the key things which you said is about engagement, talking. And I remember just before we leaving home to this evening, coming here, and I said, we decided to say, myself and my wife, we said, okay, now that the time, how many hours are you off school for? They said about, you're in school for, they said about 8 hours. Okay, fine. Within that 8 hours, your phone's not with you. We are going to take the phone to work.
Oh, wow.
Oh, my God.
So that's what we've said. Because technically, the phone is not with you. You're in school. I know you will. We're going to come there. Okay, I'm going to use the hat now. Miss Anna, we are going to come there, Miss Anna, later in the education sector, Isatta.
Exactly.
The phone is not with you, so technically for 7 hours, I'm going to work with your phone. And then when I come from work, that's when you're going to lose another maybe 2 hours, because I finish at 5. So instead of 3:45, 4 o'clock, which you have your phone, you won't be getting your phone possible till about 6.
They will say, but Dad, you called me when I finished school.
Yes.
So what happened to
hold on, Hannah. Technically, the Google Classroom is going to be on the phone.
Yes.
Needs to be accessed by the phone, because if you're going to take the phone, you make sure you take the laptop, you make sure you take the tablet, you make sure you take the television with you. Because these kids, I learned few months ago that they don't really need the phone. As long as they've got Wi-Fi and they've got other gadgets, they can go on Snapchat, they can communicate with their friends. So you're going to have to pack all these things and dismantle them and put it in your boot and drive off to work.
It's not gonna work.
Or you turn off the internet. That's the. I had a colleague at work who. They are lucky where their internet is in a study. Right. So she actually goes and turns it off, and they don't realize she's turned it off. Oh, wow. And then she locks the door. And so, Mom, the internet is not working. Oh, maybe it's the service. I've done it a few times, but then of course, if I'm at home, I need the internet as well to work. So it's really a catch-22 situation.
Or you can leave the phone with them and just call the supplier to say, "Oh, I've misplaced my phone." So they have the phone, they can do whatever they need to do, but there's no Wi-Fi. They can't make any social social media.
I think we're just gonna have to trust them, isn't it?
I think it's a trust,
and
they will get bored.
They will get bored.
They will get bored.
Because I think a lot of the thing that trickles down to the social media for them is issues that either happen in school that they have to carry on talking about in social media because they don't have the opportunity to finish resolving or sorting it out but you're all gonna be in your houses. How are you gonna know who fancies who? How are you gonna know who did this and that, who were having a banter today or an argument or a fight and so on and so forth? So it's gonna get boring.
They will get bored.
Yeah,
They
so
will get bored.
I think I think we're gonna go to the kids later when we talk about schooling. But what I wanted to talk about as well is us adults.
Yeah.
We've talked about the elderly, how we're gonna support them. We've talked a bit about the younglings. But what about us? The adults, how are we gonna manage this if we're when you're isolating? How are you gonna manage
adults
it?
as in Sierra Leonean adults because that's a specific category in itself, or is it just are we talking about adults?
We're talking about adults.
As adults because there is adults and then there are Sierra Leonean adults.
Okay.
And just like what you said, I've never had the word comrade. Corona or no corona? What did you just say?
What was it? By corona by force.
By corona by force.
Life must go on. And the thing is, on a serious note, it's challenging. As you said in your intro, we are a very affectionate community, and Sierra Leonean people are the character of a Sierra Leonean person. We're very affectionate because it's in our custom, it's in our DNA, so to speak, to get engaged, to meet with people, to sit with people, to wanting to be in somebody's face, personal space, because it's just the nature. So we struggled at the start of the Ebola until robustly we started seeing fatalities and tragedies of our own. That's when the wake-up call, irrespective of whatever logistics we were lacking from a national point of preparation point of view, but in terms of the people themselves, the mindset. So, and I think that's been the sort of lackluster attitude towards COVID-19 here from what I'm seeing as a community person, and that we say all of these things yet to try and practice it. I know I am failing. I was out today visiting friends, and I was told you cannot come close, and I know I cannot help it. I have to be close. You understand?
And an infection control practitioner,
and somebody that's delivering the communication. So it's that difficult of a task because I just felt my visit, it's not complete if I don't feel that I get a little bit cuddly or I get a little bit warm is the language. So I felt it feels a little bit informal. So that's all I can say. So it's difficult for Sierra Leonean community to administer to such guidelines.
Yeah, it's difficult. I mean, as individuals, it's so difficult. It happened to me 2 weeks ago. 2 weeks ago, I was at work and a couple of relatives came. They wanted to have a bit of a chat, and I've never met them. And the polite thing to do is I came downstairs and shook their hands. And literally, I came down and was like, "Hello, I'm Isatta. Nice to meet you. Nice to meet you." And then the other one said, "Oh, well, we're shaking hands now." I'm like, "No, go back to the chair. Let's do that." So it was like, oh my God. So it's just the habits we have, which not all of them are bad. So what I tend to do now, like today, what I was doing, I just did that. Everywhere I go, I just do that. So it stops me from literally going high, because I like to do that, and I also like to do cheek kissing as well. And I don't do one; I'll do. So I'm to myself. If I do this, that means I've created a closed body language already. So it means it's sending a message saying, you know, don't come to my personal space, and so on and so forth. So I think, going back to the social isolation for us as adults, I think we'll focus on Sierra Leonean adults. I think we're just going to have to be mindful how we utilize our time. We're going to look for things like a lovely lady yesterday said, "My work is finished. I don't know what I'm going to do." And I messaged her back on Facebook saying, Think about all the things and tasks you've wanted to do, but you never have time to do.
Yes. True.
You know, do them. For example, if we get quarantined and we're home, I will tidy up my wardrobe. I will tidy up all my family pictures. Okay. I will tidy up my paperwork, my filing. I will tidy up my drawers and so on and so forth. All the things I want to do, but I never ever get time to do them.
Spring cleaning.
You know, spring cleaning. I always put them at the back of the list. So those are the things. Try and occupy yourself physically. And one of the things I think I will be doing is I wake up in the morning and I do some exercises. And again, people say, how do you do it? I just go on YouTube. Most people have these how do you call these televisions now? Smart TV.
Yes.
You go on YouTube and you put exercise. It comes up and they're free. Yes. And then you can do 10-20 minutes exercise in your living room. If you've got a garden, you do a bit of running up and down, up and down, up and down, just for your just not your physical but your mental well-being. Yeah. Because I think what I'm trying to discourage a lot of our community to not focus on is social media.
Yes.
Because it's gonna cause a lot of angst, a lot of issues, a lot of problems, a lot of quarrels, because people are gonna make comments that they don't think about before they make them, and then somebody's gonna feel offended, somebody is going through a bad time, or you've had issues with that person and they think it's directed at them, and then it creates more and more problem, and that's not gonna be good for our mental health well-being. It is okay to go on social media, but I think too much of it is not good.
No.
It is not good for your mental state.
I'm against social media.
Yes, so I think people just have to be mindful, especially Facebook for our community. That's the platform that we use and abuse. Yeah. So we have to be mindful how we use that. Let's learn to support each other. We can get through the social isolation by supporting people through Facebook. You can make jokes, you can put information there, and so on and so forth. But what we don't want it to become, we don't want it to be a place where you're not coping at home, and then you think, oh, I'm just gonna unleash on Facebook, because it's just gonna not help the situation. Yeah. So if you're at home, and if you're not in the vulnerable bracket that we've talked about, but you feel you just need to talk to someone because you're going crazy, that doesn't stop you from calling us. Please inbox us. We will call you, we will talk to you, and we will support you as best as we can. So let's move on. I think we've done a lot. I don't know if there's been...
I think Anna wanted to contribute.
Oh, you wanted to add something, Anna? No. Yeah. So I don't know if we've got any comments. Have we got any comments?
Not on from what I can see there, but we'll be quite happy to. Yep, I think there is some comments from Alim Bundu. I don't know.
Okay, chloroquine shows promising. We will get to that. We will get to that. Don't worry, we will get to the chloroquine business. I've got lots of information for you. Don't worry about that. And then I think I saw one from
I had about two WhatsApp messages today about chloroquine.
Yeah.
Can I get them a chloroquine now?
Yeah, chloroquine. Greetings. The program is for fellow Sierra Leoneans living in the UK. Yeah. Because according to the lady speaking, yes, it is Suma Abdullahi. It is for our fellow Sierra Leoneans in the UK, but that doesn't stop non-Sierra Leoneans to. I've got a lot of viewers and participants, as always, who are non-Sierra Leoneans. And Auntie Betty Falia said she's glad there's support out there for the elderly. So we're now going to move on to day 2, which was Tuesday the 17th. Right. So Tuesday the 17th, the Prime Minister focused on finances, financial implications, and the impact that will have on the country and communities and individuals for the next for the rest of the year, basically, and some for another year or two, you know. So what do you want to say about that, Hannah?
Well, I applaud the government for actually coming to the aid of us, the civilians, by donating, I think it's 350 billion.
Yeah, so far proposed.
That they've proposed. So that is an amazing start. But as we all know, and I've heard from commentators, it's not going to be enough. because if we think about when we had the financial crisis, the levels that they said were attributed was over 500 billion.
Yeah.
Wow.
You know, so if it's 500 billion for
the banking
financial crisis, for the banking crisis, this is a global pandemic, and you know we have so many people that this is affecting, especially our self-employed. £350 is not a lot, but I do welcome the advances that they came forward with. For businesses, they've offered them like tax relief for a year.
The business tax relief, isn't it?
Which is amazing. And they've also said that they'll try and support small businesses so that they don't close or they don't go bankrupt as such. You know, so that is good. But it doesn't actually touch on the fact of what's happening right now, because most self-employed people, they're uncertain, and even our gig economic workers, some of them have already lost their jobs, some of them are already redundant, you know, and the help that the government is saying, they're not seeing that coming forward. And the government's also said about mortgage relief, but we need to read into it. Rent relief, we need to you know, we need to read into it. It sounds good, it's sound bites, but is it really, okay, mortgage relief, I mean, who can claim it? You know, rent relief, who can claim those?
You're quite right. It's going to be one of those things where if I go now and say I can't pay my mortgage, I'm probably going to have to prove that I've not been earning.
Yes.
And why didn't I go to work? Did I just decide, I'm scared of Corona, I'm going to stay home? Or was I told to stay home by my employer? And so on and so forth. So people need to be very careful, because I know people like to jump at such opportunities when they hear them. The providers are going to be quite strict and stringent with their rules. There might not be, it's okay for the government to just say, we'll do this, we'll do this, we'll do that. But we all know when it trickles down to the actual provider, because it's not the government that gives you the mortgage, it's the mortgage lender. And when you go to your lender and say to them, I am struggling, I need 3 months mortgage holiday, you're going to have to justify it. So you can't just decide that, for the next 3 months, even though I'm going to get paid, I'm not going to pay my mortgage or my rent, because the government has said they're going to give a mortgage holiday, or they're going to protect private tenants. You have to prove it, because bearing in mind, they also need to pay their money that they've loaned you
to the bank.
So and the private landlord might still also have a mortgage on their property, so they have to pay their mortgage, and it's your rent that pays the mortgage. So there has to be there has to be that due diligence and information to guide things. But I think for me, it kind of sheds light at the end of the tunnel for people who are extremely worried, because I think one of the things that probably makes this such an infectious disease more viral and spread quite quickly is the fear of people staying at home. People on like 0 hours contract who can now go and apply for universal credit. People who are self-employed who can also go and apply for universal credit and feel a little bit more reassured. I mean, it's not going to be an easy journey, but at least there's something there.
It's definitely not going to be an easy journey. But I think we can't let the government off so lightly. Because even though that they get in this universal credit, like you said, this universal credit will not pay their rent. It will not. So those people that are self-employed, especially in London, those renters, whatever they're getting from universal credit will not even go as fast to pay their rent, let alone give them food for them if they're by themselves, or even for their family. You know, so I think as a community, we should voice our concerns a bit more and just ask the government to actually say what they mean. I think when he said that, there was a lot of conversation, because the government was saying to people, you should not go to restaurants and pubs,
Yeah.
but he wasn't saying to the pubs you must close.
You must close,
you know?
exactly.
So those type of things, it's like you can't give with one hand and take with the other, because you're still placing the same people in a sense of insecurity.
Yes.
And I think in this time, what we need is clarity.
Yes.
You know, and that's one thing that Boris has never been good for. But we need clarity. If you say this, how can they? So when people that are because they're saying that they're giving this universal credit, but at the same time, it's means tested.
Yes.
You know?
I mean, universal credit at its
always
normal
been-
time has been quite challenging anyway.
And it's always been means tested.
Changing the benefit system has created a lot of uproar, a lot of poverty. People are there's a lot of allegations that it's caused a lot of suicides and so on and so forth. So I don't think it's going to be any easier for people who are finding themselves in this current situation. And I think, you know, that is why for me, when you go back and you see people doing all this stockpiling, what about the people who don't have money? And I think actually people are using their rent money to go and do the stockpiling.
They've got 3 months.
Yes, because they and even the ones who are not thinking about the 3 months, they're just so anxious about this food. You know, the one thing we all hadn't paid attention that has also kind of run out is freezers. People have been buying freezers. So when you're thinking, where are they keeping all this food? People are buying freezers. Apparently, if you go to the electrical shops now, freezers are out.
So where they putting the freezers?
In their living rooms and bedrooms and anywhere, you know.
Burning more electricity.
And then burning more electricity. I mean, what are you going to do after 3 months? I'm going to be looking. I'm going to start a freezer business. Because after that, they're going to have
stranded.
Yeah.
I wanted to come in on the finance, on the small business person, which we've kind of discussed. You both mentioned. But I'm looking at small business, i.e. sole traders or people with anything less than 4 people employment. And there is such a massive grey area from what the Chancellor mentioned to what the government is trying to hint to what is the actual reality as on to the ground. Because I know a friend who owns a local confectionery shop at Elephant and Castle. His last day was on Saturday the 14th, and he's had to close business. Okay, for many other reasons, because of the regeneration as well was one of the main push. But he also mentioned to me because of it's like a family business, but he's got 2 people who are not directly family. He's had to lay them out. And I asked him, I said, so what's going to happen? And then in his own very, very nicest way, he said, the skills that they've gained here, if they go to any big supermarket shop or whatever, they can work easy as. I'm like, what he's saying is just from his emotion to just get them out. You don't just walk into a supermarket and then get a job. So these people might be sitting within the next 12 months
unemployed.
Yeah, to get a job, most of the time you need to be in a job. It's easier. It's easier.
Exactly. So what happened to those 2 individuals who will now be
inevitably
be unemployed? They've got families. These may be fathers, or these may be married and preparing for family. The entire life has just collapsed in the space of 24 hours. A decision which has been made. We all know it's this disease. It's a natural or whatever people want to put it on occurrence, and we're not at this stage. Nobody's been pinpointed and isolated, or no one country's been blamed. Do you know what I mean? But we need to prepare for the little man, the little people that are going to be off pocket for a very, very long time. This is going to be a life changing. How do we support those people if we have those now in our community? Because which I'd like to always use as an example.
I think one of those. I think you cannot not highlight the entertainers. You know.
Oh yes, that's massive.
Yeah, the entertainers
in the financial entertainment is gone. Isatta.
Entertainment is gone. The restaurants are gone. And we all know those are the quick jobs, even for the students at university. This is where they get their part-time jobs, and they help mommy and daddy in terms of those weekly spending money.
Yes.
So then that pressure is going to go back on the parents who are already under a lot of financial pressure.
Yeah.
So it's really, really going to be hard times. But like you're saying, what do we do for our community? Is basically being self-aware and being aware of who is around you, being aware of your surroundings, be aware of the people around you, and see how best you can offer support and help. This is not the time to be ashamed.
Yes.
This is not the time, and I think this is the time for people. Somebody said it's time to reflect. This is the time to reflect. We're going to have the opportunity to stop, pause our lives and reflect and look at what our needs are and what our wants are.
Yes.
For example, you're going to look at really this. If you have a car and you're struggling with your rent, do you need that car? Do you truly need that car?
Yes. No, because that's a penny drop moment. I think what ISIS is just, you know what, that's, if you're running a home, a family home of 2 cars, you understand it? And I know within the next 3 months or 4 months, there will be no DJing gigs for me.
Yes.
Do I need the second car?
Yes.
You know,
so
and sewn it and just survive on the one.
And also,
well, nobody's gonna buy it. That's the other thing, so I can't sell it.
I'm just gonna use you as a protege.
Please,
yeah. Okay, so your lifestyle, and all of us, our lifestyle is based on our income.
Yes.
But one of the other things we do. Oh, somebody's calling. Can we answer?
If somebody's trying to call,
So somebody, we all we tend to, we live our lifestyle based on our income.
Yes.
But one of the things we also do.
Answer from that.
We're trying to get a caller. Have we got it?
Hello, caller. Hello. Hello. The line is trying to connect. Hello. I think they should call on WhatsApp.
Call on WhatsApp. Ping the number.
Yeah.
Ping the number for WhatsApp. Call us on WhatsApp, caller. We're gonna put the number. But I think it's about us. What we're very good at in our community, and I think some other communities as well. I listened to an audio a week or so ago when a lady in America actually put it really well for us Sierra Leoneans. She was focusing on America, but it kind of applies to us here as well. And is that we live above our means. We totally live above our means. Why? And that is how we end up with second jobs.
Yeah.
For example, you've got your monthly regular income, but also you've got your DJing. Now, a lot, like you're saying, the car you're running is probably based on the income you get from your DJing.
Sure.
And your regular income goes towards running the house, the family, and so on and so forth.
That's right.
And then, of course, we've got extended family back home that we have to support, and so on and so forth. So this is time. This is really time. And I remember that lady said in the audio, this is time for you to think and pause. If you're someone doing a building project back home,
Pause.
Is this really the time for you to continue buying that 100 bags of cement? Pause. Is this the time for you to be doing your floating? Pause. Is this the time for you to be doing your roofing? Pause. Think about it and see how things are going, and so on and so forth. And look at how you can cut costs. Truly look at how you can cut costs. Lifestyle, and so on and so forth. Can you really, I personally, because of all the charity work I'm doing and what I've seen in my motherland, and I've said some of the decisions I made this year is I will think very carefully before I buy any new clothes, especially Western clothes. I would think very carefully before I buy another new pair of shoes, because I think that money, the cheapest pair of shoes I will buy is £40. Now that money can go to a lot of things not for me personally, but to improve somebody else's life. So I think we have to think about all those things. Some of my friends at work made the decision this year that they're going eco-friendly. And so they're going to charity shops. They've decided I will buy clothes, but I'm not going to buy new clothes. I'm going on eBay and charity shops.
There's nothing to be ashamed with those type of things, and I think it's about having that financial conversation as well with our kids.
Yes,
you know what our kids used to once in the past, and you might not be, instead of you buying that whole pack, you might just buy one or two and you get them to just to ration at home. Yeah. You know, so it's not just drink anything you want now because I'm not gonna have the time to go out to go and buy some more. But like you said, I do agree, it's like we have this habit of living above our means, and then when things get hard, we complain. Yes. You know? And this is the time where we have to actually search deep and make conscious choices, and don't feel bad if someone then use that as a negative against you, because I know that's something that also happens. Oh, look at him, he used to have this, he doesn't have it anymore. No. It's not something for us to feel bad, because you know why you're doing what you're doing.
Exactly.
At the end of the day, it's about these times about us surviving.
Yeah.
It's about us making sure that we can.
Can I just interject? I just want to give a quick example where
chop touching your waist.
You see the habit, it's natural. Well, let's do this live. Let's do this. No, you're right.
He's just keep touching his nose. Let him.
He's trying to grow like Michael Jackson. He's trying to grow like Michael Jackson.
He's sanitizing him. So, he needs sanitizing. Give me thumbs up, everybody.
Infection control panel.
We're sanitizing this young man here.
Practitioner is just so. This morning I got up, as I said, I had to go and do a visit, and consciously on any given day I'm spoiled brat. I would have jumped in my car and then drive out of the congestion zone, which is going to cost me £12.50, and that would have been any other day. Like, you know, I don't care, because I just love my convenience. I hate traveling by bus. I jumped on the bus, got on the bus, walked towards Elephant, got on the bus, and then realized I got on the wrong bus to take me to where I was going, and I got off from where I was getting off, and then decided to walk. I walked the wrong direction back to where I came from, because I don't know how to commute by bus. This is genuinely the truth. I don't know how to commute by bus. So I walked back to where I had come from. Yeah. Halfway through, I thought, this was where I was coming from. So I then walked back. And then so I walked my journey after my long 4 hours visit. And then I decided to walk from my location all the way back to King's College Hospital, which took me at least the best part of an hour walk. But I felt good, but I'm thinking, I'm really spoiled.
Yes.
I know I have saved myself £12.50, but I am really spoiled. I need to do this maybe often. Do I really need to use my car all the time for short journeys? If my mother would say, after work, can you come by? And I would say, okay, I'll come by. But when I get home, I'll go and pick up my car.
Yes.
Isatta knows there's about 10 minutes under from my house to my mom's house. Why do I need to go and get my car to then drive back to my mom's house when I could just go off the bus and then walk for 2 minutes?
Yeah, I'm the same. I think there was a couple of days I needed to go to work without my car, and I was so flustered. I was confused. I was disorientated. I thought I was going to have a panic attack, and so on and so forth. And I was like, and then after the 2 days, I thought, you know what? This summer, I'm going to start not using my car, because as much as I need my car, but there are days where I have office days, and those days this summer, I am going to leave my car at home. And if I need a car emergency, we have pool cars at work. So it's not like I'm going to try and find a reason not to take my car to work, because I think it's just those little things. You think you can't do without this, and you can't do without that, and so on and so forth. So you're quite right. Like this Monday, I had a meeting with my kids about the financial implications of what's going on. So we talked about eating sensibly. Because I don't know about your kids, but my kids, they're very wasteful. They're wasteful.
Take it.
Yes.
Leave it.
My daughter especially, exactly. My daughter. So yesterday I went home again. She'd opened a whole pack of biscuits. She ate about 3 of it And then the rest of it was there. I said, who left this? Oh, it's me. I said, what are you? Oh, no. I said, can you take it back, fold it and put it in a Ziploc bag? Because guess what? She's going to do that, put it in the cupboard, and the next time she goes, it's going to get soft. Yeah, I don't want it anymore. She's going to bin it all. Yeah. And I said, listen, most of this food I'm buying, so actually today, I had to hide some of the food. Because the more food they see, the more they want and they're wasting it because they're really not hungry. And I said, I'm not buying all this food. I'm buying this food because I am probably going to need to support people that need food. So this food is not all for you. And my daughter looked at me as if I was an alien. Yes, it's always for us. It's always for us. Yeah, that's it. All I do is feed you. So I think that we need to think about that wisely. So we'll I don't know if you two have anything to add on, but I was just going to read through some comments and then we can take a break, right?
That's fine, yes.
And then when we come back, we can then focus on the schooling because I know that's what a lot of parents are waiting for. Yeah. Okay. So some of the comments we have here, and I'm going to go a bit because I think someone did mention, Mabinti said, I think this is in relation to social distancing and self-isolation, what you do if you're isolated in your own home. And she said, I'll be using the time to unpack the boxes I hadn't unpacked since I moved 2 years ago. Which is true. When you move,
I think that's, and are you sure that's not you talking?
And then she mentioned something in relation to the finances. It's for those individuals who won't be paid by their employers. For example, Virgin employees, they've forced, most of the employers to take an 8 weeks unpaid leave. Can you imagine? So she's saying those are the people who would get this universal credit because she works within the finance business. So she said they are the people who will get this credit.
Well, DJ Ish has mentioned earlier from a conversation, he said his company that he works for, as which has asked members of staff, especially senior members of staff, to considering taking 1 day off, which is voluntary day off, which will be unpaid for now, or with a consideration of having 2 or 3 weeks consecutively off. So basically, they're taking 1 day off your 5 days week, 5 day shift, or alternatively, you're giving automatic 3 weeks off.
Hey,
unpaid.
Yeah.
Who's gonna pay your bills?
I know. And
so I think it's a good thing right now to be employed by the National Health Service or being
the public sector.
The public sector. Yes. You understand? It's a good thing right
the
now.
Public sector. But I don't know if I had something wrong. But I had yesterday they were talking to a head teacher, so there was a bit of discrepancy whether teaching assistants are going to be paid or not.
Well,
so
that is I'm not sure, but teaching. So for instance, I am on a what do you call it, permanent contract.
Yes.
It's not necessarily the case for some
for teaching assistants. Okay.
They might be per rota.
Okay. So those
they
people,
don't work,
they
don't get paid. That's my understanding.
Okay.
So yeah, because teaching assistants are not on permanent contract, so that will affect them.
Wow. Wow. So I think somebody said here, another comment here, after this comment we'll be rounding up and going for break, producer. It says, Hannah Conte says here, financial impact is going to be immense. I was in a bus this evening and a lady on the phone was talking about the loss of income at her workplace. Her workplace has closed. You could hear the concern in her voice.
Wow.
Oh yes, we're going to have a lot of that. So I think let's think. Thumbs up to the sensible discussion with our kids. That's our very own doctor. Good day, Isatta. Good day, Zainab. And I think this is where for me, I'm very passionate about this. It's about knocking at your neighbor's door, calling that friend you used to hang out with. All of a sudden they've gone quiet on Facebook for no reason or another, and they usually are there every day. What's going on? Check on them. Do just that well-being check, we call it. It's a well-being or welfare check.
Welfare check.
Yeah, welfare check.
Yeah.
You call, hey, you don't tell I'm not hearing from you. How is it? Waiting they go on. And sometimes you can source out. Or if you hear rumors or gossip about someone losing their job and stuff, there's no need joining in the gossip or the rumors. And if you talk to them, you don't feel comfortable and to ask them. What I would suggest, if you and that person have that type of relationship, is actually, we all know what basic necessities are, isn't it? Stop by the shop. So I'm coming to see you. Stop by the shop, pick up a few things, and just say to them, or even if look in your cupboard, what do you have? What can you, because, I mean, people are buying, like, how many toilet rolls can you use? How many toilet rolls can you use? I buy the whole pack from Costco,
Yes. Oh.
And that thing lasts me for 3 months. So I see people buying hundreds and hundreds of toilet rolls. What are you doing? What are you doing?
What are you going to be eating?
Exactly. Isatta Jalloh, Cal Footprints, did a status a few days ago saying, if you forget to buy the food and then you buy the toilet roll, how are you gonna eat? I can't remember how he put it. Like, basically,
if you do number 2,
if you don't eat the food, how are you gonna How are you gonna produce the pool for you to use the toilet roll? For you to use the toilet roll. So I mean, it's that kind of thing. So please.
So guys, can I please just touch? I don't know if you plan on touching it, but when you're talking about finances, I just thought it was really important to talk about those shops that have hiked up their prices, and that really got me engaged. So I don't know if
we can talk about it now, producer. Can we talk about it? Yes. 5 minutes on it.
Yes. So I went to Peckham yesterday, right? I know some of you were probably there, because I know some of you were there because I saw your faces. I saw your faces there. I was in a shop. Can I say the shop? Yes. I can say the shop. Baba Limited. It's opposite Primark, next to KFC. I was in that shop, and I saw them selling a bag of rice for £53. And I said to myself, "Are you serious? Are you actually serious?
You're trying to manage your rice diet.
You're trying to manage my rice diet, But the reason why I brought that up, and on all serious notes, say like places like Peckham, Brixton, Lewisham, Dalston, where we know our population is high, we are the ones that give these people their lifestyle.
Yes. Yes.
So in times of need, like Boris Johnson has said, and he talks about being a community, all these shops, they've all hiked up their prices, and we've been told there's no shortage in food, so therefore there's no need for them to be hiking up their prices. But these people that we help have their lifestyle, they are not supporting us as a community. And like we said, those people that are losing their jobs are the same people that need to go and buy all these things. So I was very angry, to the point that, because I just listened to the news when they talked about school closing, I was just thinking, oh, my kids, some of them, I know their parents are suffering already. Yes. And they have to go and they have to buy food, and this is where they come and do their shopping. Yes. And this is the price that these people are doing. How dare they do such things? And I was so enraged, and I was just saying to people, you know what, I need to do something about this, because this is not right. Because if we don't go into their shops, they can't have the lifestyle that they have. But we need to do that thing as a community, where we come together and vote with our feet and say
hands,
and say we're not going to these shops. For instance, someone just sent me something. They said that. I know, like Tesco's and Sainsbury's and Morrison's, they're all doing something to support our community.
The local community,
but these shops that we make them have what they have nowadays, they're not
giving back anything to us. They're not giving back anything to us. You're so right.
But I think I want to be devil's advocate just briefly. I think what it is, Anna, you're failing to realize, these are shops that, even though they've been there, the community, yes, as you say, do support them. Many a times we've all been paying so much focus on the big supermarket chains and all of that stuff. This is their opportunities to now make extra income. I am not condoning the obscenity in the price hike, but what I'm thinking, okay, this is my opportunity. I'm a small local businessman. My orange, my grapes, my fresh fruits, was staying for weeks on end and not making money. So now your Sainsbury's, your Lidl, and your Tesco's are now running out. You're coming to me.
That's the thing. Correction.
Okay.
They are not running out. It's because of the panic buying. But every day you go to these shops, they are replenished.
Yes.
Every day, and even yesterday, the lady at I think it was Morrison's or Asda, one of the managers that they interviewed, she said, "I have never seen supply of food come as frequently as it is coming." Ever in her working life in her shop, in her supermarket, even for Christmas, which is the busiest, you know. So she's saying there's plenty of food. She was saying, she was reassuring you don't need to, and so on and so forth. But what I suspect and what I think is happening, let's take for example cooking oil. These cooking oils are being bought. These people from these local shops are going into these supermarkets,
buying it.
They are buying it and then taking it to their shops and selling it. And I'm seeing people go in there buying. For example, Tesco does offers on those 5 litre. How many oil would you cook
in a year?
Why do you think you desperately need 5 liters of oil when you can have 1 5 liter for a very long time if you're eating sensibly and you're looking after your health and well-being? So I think you're quite right, Hannah, and I think we have to challenge them.
Yes.
Like when I went on Tuesday and they were telling me Indomie, Indomie you're talking about, okay, some of us, our kids like Indomie because their friends eat Indomie, but their kids, it's not an option and it's not a choice. It's because that is all their parents can afford. So and this they used to buy £3-4, right? You buy the box £5, and 3 weeks ago I bought a box £8. Now this Tuesday it was £18. One shop, I went there, it was £18. I'm like, no, this is not right. And then I went 2 shops down, it was £20. I'm like, what? And then I went another 2 shops down, and then the one at £20 said, oh, you think I'm selling it expensive? Go to the next one. So I went 2 doors down, and it was £22. I said, what is this? I didn't buy it. I thought to myself, why am I going to buy Indomie that I used to buy for this amount? It's not even a healthy food, you know. It's not. It's just because it's an easy fix for us kids, working parents sometimes. It's true. And I really restrict my daughter how many times, because she's obsessed with it, and I have to restrict her that she shouldn't eat it more than twice a week.
Because it's the first time kids feel they can cook.
Yes, that is the thing.
It's the first my 20-year-old man, who's going to be 21 soon, that's the first time when he was young felt he can cook. And then when he started making Indomie as young as he was, and then start preparing.
Yeah, that's the point, you know. That's the point.
That's the reason why they embrace Indomie so much.
Yes.
So what the government has said is if you go into a shop and you see that there are price hikers, it is illegal. Please call this number 0203 738 6000 and report them. 0203 738 6000. I'm sure I've seen it going around in social media. Please call and report these people. When you go into the shop, please take pictures of these prices so that we can post them, so we have evidence of what they're doing.
Indeed.
Because it's only those shops that are doing this. If you go in, like I said already, Tesco's offered service for the elderly. They've offered service for the healthcare workers.
Yes.
They're doing so much to support the community. I've just got
and they haven't changed their prices.
Haven't changed their prices at all.
The prices are the same.
How come they haven't changed their prices and all these market streets have changed their prices? Starbucks is offering free coffee. Benugos is offering free drinks. McDonald's is offering.
Burger King.
WH Smith's they're offering. Pret is offering. There's so many shops that we tend not to go to, but they recognize what we're going through, and they're doing something for their community. And these people whose pockets you line every single day, they don't even give a damn about you. They'd rather that you go in there and you spend the money that you don't have just to put yourself into more debt, just to make sure that
in fact they laugh at you.
They laugh at you.
They laugh at you.
They actually laugh at you.
No, I turned my back the other day. I'm like, no, I'm not doing this.
The scariest thing is, honestly, I was at rage at this shop. and I saw my fellow Sierra Leoneans, because at first I was just speaking English, then I eventually I changed into Korean, and I saw my fellow Sierra Leoneans, and there they were saying, oh, just then they were just picking things and going.
All for myself.
Things and going. I said, this is the reason why we don't have this unity. Because if every single Sierra Leonean, let's just say Sierra Leoneans, if every single Sierra Leoneans don't shop in Peckham, would their shop exist?
No.
It will be our population in Sodok is quite large.
It's very high.
Yeah, we have the largest population of Sierra Leoneans in Sodok.
Yeah.
So I think it's the thing. Well, this is the thing sometimes in our community where we need to make the noise, we don't make the noise there. We go on social media and we cuss each other and we disrespect each other, we humiliate each other, we do unacceptable things to each other, we damage our emotions and so on and so forth. When it comes to time for us to stand for our right
and be united,
we don't do it. I mean, it's really, really sad, it's really disappointing, but I think we need to stand up and do something, and hopefully there are the likes of you, the likes of me, and I went, and the same with my sister Nuna. She said to me, she also went and she said she tore them apart, and they're like, we'll call the police. She said, call the police.
Oh, may I just say they called the police on me?
Oh yeah, you did say. Yeah, she did say.
The police came and the police were just saying, yeah, you're right, but there's nothing we can do about it.
Yeah,
and I was just saying, and I'm like, yeah, look, the police is here. What do you want the police to do? I said, what I'm saying, it is right, okay? I'm not saying don't make your money, and on top of it, because the government has offered them this tax relief, that's money that they're going to have anyway.
Yes. So they're making double money, isn't it?
Double money.
They're making double money.
Misery.
Yes.
You know, so that's one thing I like to say to our Sierra Leonean folks. Please, you know, if we all stand together, you walk down, I know like there might be queues in Morrison's and all of those. I'd rather you queue and not go to those shops so that they know that you are a value customer. Because if we don't shop in their shop, those mortgages that we're talking about, they won't get paid. Those cars that they're driving, they won't be able to
and
drive
some of these people, you see them, you think you go
to
their homes.
They don't live in Peckham.
No, they don't. They all live in the outskirts. They all live in the outskirts.
That is so true, Hannah.
I mean,
no, that is so true. They don't.
You know, I take my hat. For saying that though, I take my hat off to our local off license.
Yes.
So what I've been doing in the past few days, every day when I have the opportunity, I'll just do a quick like a shopping sweep. Just go around the local area, see what shop has what, and so on and so forth. And I must say, I've been into a couple of shops where this man had quite a lot of like toilet roll, paper towel, and so on and so forth. And he was selling them a normal price. And what he was actually doing, he was one of the first shopkeepers that I saw was restricting how many items, quantity people could buy. And then the same for my local shop. So, for example, with this project we've started with this COVID rapid response team, I know a shop where if we need to buy stuff, that's where I'm going to go. They are still stocked.
And they're maintaining their price.
They're maintaining. They're off license, which means they're always more expensive than the supermarket. But they're only about 20 or 30p more. And they've maintained it that way. And they are also saying certain things, no, you can't buy more than one, you can't buy more than two, you can't buy more than three. And I'm like, I actually said to them, kudos, you know, well done for what you're doing. So I think let's just go on a 5 minutes break. Producer, 5 minutes break, and then when we come back, we will talk about schools. Schools.
My daughters are watching.
Yes,
they are watching.
We will
My
talk about
nieces
the closure
are watching.
We'll talk about
schools, and
I'm
then,
still going to school, by the way. I don't have time off.
Yes. So and then we'll do that. Are you ready for us? So don't go away. Just go grab yourself. Go wash your hands with soap and water, sanitizer, and then grab yourself a cup of tea.
If you've done what DJ Little has been doing, touching your nose
and
rubbing your ears.
Maybe we're catching up here. Like I'm trying not to.
This is what I've been doing.
Just do that.
Yeah.
I'm trying.
I'm not talking to you. You know, like how the little kids do.
Yeah.
I'm not talking with you. I'm not happy with
I think
you.
I'm gonna have to find me a softball.
It's like a stress ball.
A stress ball. Like, what is going on? You know what I mean? This is so
This is interesting. It's challenging times for us. But ladies and gentlemen, please, let's all be patient. Let's all think carefully and wisely and make the right decisions. We will be coming back shortly in the next 5 minutes. We're ready?
If you're having credit problems, I feel bad for you, son. 1,000 problems, but a car rank 1. Wills for sure got me back in the car. Leasing with my credit, I was like, man, forget it. Who would have thought I'd be accepted and more? But now I got the keys, I feel so pleased. All types of cars, Fiats, Minis, Renaults, you know, boom, boom, let's go. Wills for sure, car leasing for every credit score.
So, Nikki, you're a winner.
Yeah, I've won 3 times now.
Wow. Is that all through Lifestyle Bids, right?
That's right. So first I won the Music Awards, which was in London. Then I won the boxing match, which was in Cardiff. All you had to do was bid 83 pence for that. And then the music festival, which was in California.
And the private jet?
Yeah, me and 3 mates won that too.
So I think it's definitely safe to say that Lifestyle Bids works for you.
Oh yeah, Lifestyle Bids definitely works for me.
So don't just dream it, bid it. Go to lifestylebids.com and let the adventure begin.